Good afternoon, everyone. We will go ahead and begin. I want to welcome you and thank you for joining us today for this webinar. My name is Caryn Bell, and I'm an Associate Director for Partners for Advancing Health Equity, or the P4HE Collaborative for short. We are a national research learning collaborative that aims to bring together various sectors that are working on health equity, including government, academia, community-based organizations, philanthropy, and the private sector. We are based at the Celia Scott Weatherhead School of Public Health and Tropical Medicine at Tulane University, and we are sponsored by the Robert Wood Johnson Foundation. Here at P4HE, we convene these sectors to work together to better understand critical issues related to attaining health equity. One of the ways we do this is by providing spaces for activities to engage with these groups in insightful conversations on timely topics and to promote actionable solutions. During this quarter, our level setting dialogue introduced a working framing of narrative power and established a foundational understanding of how this impacts health equity. Participants at our interactive learning session refined and co created the framing of narrative power to inform today's discussion. They also shared their experiences and ideas for next steps. During our workshop sprint, which took place in May and earlier this month in June, offered insights into how collective storytelling and shared learning can strengthen efforts to advance racial health equity. And in addition to our live programming, P4HE authored products to provide examples of and useful resources for leveraging narrative power in health equity work. So today, we will go beyond our shared understanding of the importance of leveraging narrative power for health equity by discussing how we can overcome challenges to narrative change and sustain narrative power to improve health outcomes for all. The goal of today's discussion is to work towards specific action steps that individuals, specific sectors, and cross sector collaborations can take to advance health equity through community storytelling, coordinated messaging and dissemination, and narrative infrastructure building. All right, so before we hear from our panel, we want to start out by hearing from you. We want you to drive today's conversation. So to do so, we will be using Mentimeter, which you can access by scanning the QR code on your screen or by going to www.menti.com on your browser or mobile device and entering the code 89582472. So I'm going to do that as well since we're all working together and this is about being a collaborative. You can go to menti.com and type in that number, or you can scan the QR code on your screen, 89582472. All right, hit join, and then you can hit the thumbs up to let us know that you are there. I do see a couple of thumbs up coming through on the screen. Awesome. Somebody asked, will the recording be available? Yes, definitely of this. We post all of our recordings on our YouTube page. Definitely follow us on social media for everything that we do, as well as our resource library on our website. Okay, so I think we can go to the question. It says, how do you think storytelling can lead to changes that promote health equity? All right. This is one of those open-ended questions. You can respond however you want. You can put multiple responses in. So take your time, think about it. As you are putting in your responses, the panelists will be able to see what you're saying. So I'm definitely going to ask them about what you're thinking. All right, so we have some responses rolling in. How do you think storytelling can lead to changes that promote health equity? The thing is, I have my glasses on, but I can't really see everything that is on the screen. Builds connection, empathy, or makes people feel empathy for others, um, puts a human face on the issue. Yeah. Sometimes statistics is not able to do that or not able to do that. Yeah, it's hard to see the responses. So I'm trying to run through them so that we can see or at least hear what some people are saying. It builds trust. Thank you so much. I am, a millennial, but on the older end of millennial. So I was not able to see that. I appreciate you so much. Um, Storytelling reflects actual occurrences, so people's lived experiences. Stories make data real and personal. Yeah. Storytelling can build trust. Thank you even more for making that bigger. Cultural mindfulness, that's an interesting concept. I think I said this already, but builds trust. Voices of those most impacted are included, elevated, and justified. I appreciate that language. Storytelling centers the voices of community members, opens people's minds, especially for those who may not have met many people with different experiences. Yeah, I'm going to ask the panelists about that. Creates empathy. Okay, you can scroll down. Thank you so much. Um, Lived experience is very powerful to promote change in health equity, humanizing real world experiences, visual information turned into action. Now that's interesting. Seeing as how storytelling, if you've studied anything about storytelling, there has to be some action and then there has to be some conflict and some resolution. So, we need a lot of action in health equity as well as resolution. Um, Storytelling makes an issue more relevant and human, can center community voice, and community wisdom. Thank you for that as well. Provides opportunity for cultural relevance. Yes, that's very important. Hearing lived experience can support policymaking, shifts or removes bias by focusing on human connection and perspective. Awesome. Helps to advocate for others. Anytime a story that depicts inequity, it puts a human face on the issue. And a story stays with people longer than stats. I totally agree with that. Builds empathy, creates community ownership of the stories, and exemplifies how structures work in the day to day lives of community members. I so appreciate these responses because you're literally saying what storytelling can do and why we need it in this field of health equity. And I'm going to ask the panelists more about that as well. I think we have another question that we can go to. Okay. It says, what tools or resources do you need to leverage narrative power in health equity work? What tools or resources do you need to leverage narrative power in health equity work? All right. So, same type of question, open ended. You can put as many responses as you would like. So go for it. All right. Digital tools. Yes, our quarter 3 topic or focus area is digital health equity. So we will be getting into that even more. Establish trust, time, patience, unconditional positive regard. That's very interesting. Yeah, that was very interesting. Platforms to easily and anonymously, collect stories, establish trust, political and societal safety. Yeah. Equitable community partnerships, shortest and simplest guiding infographics. Yeah, very important. Research to accompany the stories. Okay, having a multi-pronged approach, social media, funding, funders that are excited to fund operational elements such as communications work. Yes. A platform that reaches decision makers, understanding of cultural literacy. That's, yeah, very much necessary. Visualization tools, time, addressing stigma, funding again, trust, empathy, community partners, tools that identify the speakers or contributors of ideas. Okay, that's important and interesting as well. Cultural competency, community engagement, pathways to better co-governance with communities sharing their narratives. Yeah, I think that's very important. I'm going to ask the panelists about that topic. Um, Executive leadership, sponsorship, and buy-in. Okay. And tools to establish trust and benefit the community members whose stories we are telling. Yes. Someone is asking for the link in the comments. If you go to menti.com and type in the number 89582472, or use the QR code on your screen, you'll be able to get it. So anybody who came in late, that's how you can participate. Political and society safety funding, high-speed internet, basic, but definitely necessary. Thank you so much. Story development tools for beginners. Okay, this is awesome. Obviously, you all have been thinking about this, either working in it already and thinking about it. So that's very important. So I just want to encourage you all to continue to think about these questions, but also think about other questions that you might have for the panelists. Um, just thank you so much for providing this input. It's definitely going to start off our conversation. Please continue to put thoughts and comments in the chat. And if you use social media, you can talk about this on Threads or Blue Sky or Instagram, however you're doing it, TikTok, whatever you're doing. Okay, so we will now move on to our panel. And I want to introduce our distinguished guest. First, we have Dr. Mama Deborah Pierce Fakunle, who is co-founder of Discover Me, Recover Me, Enrichment Through African Oral Tradition. Hello.
Oh, I'm trying to get in here. Hello.
You're here.
Okay.
Hi,
Good
hi.
afternoon. Good
Good
afternoon.
afternoon. Good afternoon. Thank you so much for being here.
Thank you for the invite.
Of course. Next, we have Lindsay Smith Rogers, who is Director of Content Strategy and co-host slash producer of Public Health on Call podcast at the Johns Hopkins Bloomberg School of Public Health. Hello.
Hello, it's an honor.
Of course, thank you for being here. And then last but certainly not least, we have Lacey Wind, who is Vice President of Tribal Health Programs at the National Indian Health Board. Hi, Lacey.
Hi.
Hi. All right. So, like I mentioned before, throughout the quarter, we've heard that community storytelling and innovative communication strategies are helpful approaches for leveraging narrative power and health equity work. So, I want to ask each of the panelists how you use storytelling or communication strategies in your work. And I want to start off with Dr. Mama Deborah. First, I should ask, and I should have asked this before. Do you want me to refer to you as Dr. Mama, Dr. Mama Deborah, Mama Deborah? I should have asked beforehand.
Your choice. Whatever you want. I will answer. Okay. Yeah.
Yeah. All right. Well, Dr. Mama, can you tell us how you use storytelling in your work?
Well, particularly in Discover Me, Recover Me, we use storytelling as what we call a healing modality. We use it in situations where people are recovering from trauma, and we have story hours and sessions with them. So a lot of our work currently is with folks in recovery from drug addiction, and we have opportunities where we share stories with them, and we lift up virtues. All of the stories that we share, we have them identify the virtues that they have in themselves, even though they may have not been using them to the best of their ability. We need them to know that they have those virtues, they have those characteristics, and that's what we elevate in the telling in those spaces.
Sorry. Important work. As we talked in our planning call, we all have a Baltimore sort of DC connection. And so I'm excited to hear more about your work and how you think about storytelling, but thank you for that summary. Lindsay, how about you?
Yeah. So, first of all, I wear two hats with the podcast. I'm the producer. I'm also a co-host, among some of the many things that I do at Hopkins. And, storytelling is really about bringing people's lived experience to different things like data, evidence, policy. Part of our approach to the podcast is that they are conversations. So whenever we ask a researcher to talk about their work, they are bringing the personal side of themselves. Many public health people, as we all know, get into this work because of something that they experienced or witnessed. and they want to, bring policy and data into that conversation. Where I see it also happening in the world is that podcasts are becoming a really powerful platform for different communities to be able to tell their own stories. And so, part of what we do is we network with other podcasts to help them learn and grow and figure out how to reach the audiences that they want to reach. And again, all of it is conversational. I think those are the best podcasts that have some kind of narrative format that goes with them.
And what about you, Lacey?
Yeah, so the National Indian Health Board is the only nonprofit that was built by tribes for tribes. So we have 575 federally recognized tribes, right? And the population, when you say American Indian, Alaska Natives, are all bunched up as one population because they're so small. It's easier to collect data. But in that 575 tribes, they have they're different nations within the United States. So they have different languages, cultures, and traditions and ceremonies and ways of living. So the way that we have to have storytelling as a part of our work to really be a united voice of that many nations. And so we do that in various ways of having listening sessions. We always have advisory boards. And we try to get a collective representation of all of those tribes so that then we can advocate appropriately.
Thanks for explaining that. And really it brings up a idea for me about like potential challenges that can come up for you all when you're doing or using storytelling and narrative empowering your work. And so I guess I want to go in reverse order. So Lacey, like what types of challenges, particularly thinking about you all representing many nations and different cultures and languages, like you said, what are some of the challenges that come up for you in that work?
Well, I think the first challenge is that Western practice isn't always relationship based. And to do any of our work, our first value has to be relationship. So how do we build that relationship first and honor those stories and then interpret it correctly? I think that is the first and foremost challenge, but the most important step in telling those stories. Other pieces are that, we talk about trust. I think that was on a lot of your responses, that we are really a lot of misclassification in data. A lot of people have used our stories for funding, and then there was no reciprocal relationship. And so really making sure that we are not harming or continuing to harm in that historical trauma that has continued to happen. I think those are all pieces that you have to think about before you elevate those stories. So relationship and then reciprocity and really honoring and making sure that you're accurately doing that. And that's a big challenge.
Yeah, huge challenge. Yeah, thank you for sharing that. Lindsay, what about you? What type of challenges do you see in your work?
Yeah, I mean, so I think podcasting in general, just to name it, it is a medium that is still very coded white, often coded male. It is very often coded as something privileged. And so just the medium itself brings with it a sense of privilege, and it's not quite as mainstream as some other mediums. And so we always keep that in mind. The context there is very important. I think as a producer, one of the things that I constantly struggle with is determining who gets to tell the story and what story is told. And how does that person's perspective matter to the greater context of the story? We do our best to make sure that we're identifying the right guests to feature on our show. We do our best to make sure, if we're writing or we're talking about a story about dental health, and we want to talk to a journalist who's been studying it, is that really the right person to sort of tell that story? And then as a host, I want to make sure that the person that I'm interviewing feels comfortable. I think a lot of times, especially if someone is not used to podcasting, and again, like that podcasting itself can be a little bit loaded, I want to make sure that if they're new to it or they haven't ever been on a podcast before, that they feel really comfortable in coming and telling their story, that they understand the potential impact of telling their story and the visibility it can bring to them. And so I just want to make sure that all of that is known at the top.
Another important challenge. Thank you for sharing that. What about you, Dr. Mama? What type of challenges do you see in your work around storytelling? Oh, you're muted. Yeah, sorry. There we go.
Okay, in the healing spaces, the challenges would be that some people certainly are at different levels of healing, okay, and aren't yet comfortable with speaking out. But one of the things that we do is we include ourselves. We tell our own stories in those spaces as they relate to those spaces in an effort to build more trust and camaraderie among the people that we're with. So eventually we get to the point where people will share, people will add and advocate, but it takes a while to understand that we are there for the benefit of sharing and not just taking from them and using it somewhere else. So I think that makes a big difference.
Yeah. I've always wondered about storytelling around traumatic experiences, and I understand how it can be a part of the health equity work that we're doing. But I've been thinking about like re-traumatization or um, like shared or what's the word when you are experiencing or you're not experiencing it, but somebody else is vicarious
Mhm.
traumatization. I was thinking about it in terms of like Black maternal health. So I think, Dr. Mama, for you, I would ask about this idea of somebody put in the comments secondary trauma or
Ah,
re-traumatization. How do you deal with that when you're doing storytelling? Because I think that impacts like a lot of the health equity work that might be using storytelling.
yeah, but a lot of what we do is we use actual stories for them to see themselves within the characters of the stories, not to have to talk about themselves specifically, but to
Right.
talk about the story. That's what we do more than anything. So that
Yeah.
makes it easier, for them to.
But
And then we
yeah,
bring people into that space who have the same, particularly my sister, who we take with us a lot of times because she is 40 years clean from drugs and alcohol. So we put her in a space along
right.
with us most of the time. So that aids
Okay.
also. Mhm.
Yeah. Thank you. Thank you for even that was very plain. Like just using dramatization is a way to do it. So yeah, thank you for that. Um somebody asked in the Q&A, do you have any resource recommendations and or can someone speak who is new to speak to storytelling, who is new to storytelling and how to use their lived experience toward creating change? So I will say before anybody answers with any specific resource recommendations, we did have our workshop sprint, which was recorded and will be on our YouTube and other um, platforms like our website as a resource about storytelling. But do any of you all have any resources that you would want to share?
Well, I was going to simply say in the work that we do, you can find stories any and everywhere. Okay. And one of the things that you can, as a storyteller, because I am a storyteller, one of the things you can do, you can read one story and change that story to whatever message that you want to give, to whatever characters that you need inside of that story. So you can find stories online, you can find stories in the library, you can listen to people and hear story, you can write your own stories. So you can provide stories. It's just the message that you want to send and how you want to send it.
Anyone else? Resources that people can look to for storytelling? If not, I will say that our workshop sprint was very good.
Okay.
And I learned a lot myself. So I think that's a good place to start.
All right. Yeah.
Yeah. Wanted to ask about well, actually, I asked this next question in the Q&A that says, how do we ensure that community stories are not just collected? And this is something you were referring to and talking about, Lindsay, but how do we ensure that community stories are not just collected, but actually shape institutional decision making, budgets, policies, and program design, especially in systems that have historically marginalized those same voices. And I meant to say Lacey, not Lindsay, so I apologize. Because Lindsay, you were talking about it. Sorry, Lacey, you were talking about it. So I'll go to Lacey first.
Okay, I'm rereading it for a second.
Yeah. How do
Yeah,
we ensure that community stories are not just collected, but actually shape institutional decision making?
yeah, I think that first of all, it's making sure that the story is correct, right? So how you're interpreting it, and double checking that that's how it should be interpreted. I think that the most powerful way in those pieces is to have those because it's all about relationship, right? Stories are relational. So having those people tell their own stories versus interpretation is one good advocacy way to get that into policy. I think that when you get a collective of some of the same stories to really show the impact is really important. And also, I think that it's really we're always going, so I'm in DC, right? We're always going to DC. But when we then invite people into community, into some cultures and share that way versus the outside trying to understand, because there's a lot of things that happen that you just can't comprehend within culture. So really understanding kind of that, again, that reciprocity and how to do that safely, I think are very powerful ways to really kind of break that barrier for policy and budget and advocacy. For instance, I have one really quick one. The federal government never lets us use food, like we don't get to pay for food, but any event culturally has food, right? And so how do you budget or advocate for a grant or a fund that if I'm going to do an event and I want people to come, I need to provide a meal? Because it's about relationship and reciprocity. If you're going to share my story, I'm going to share food, those kind of pieces. So I think that having a good understanding of why things happen in order to really advocate and understand to the funders or to whoever you're advocating for.
Yeah, we were just talking about how food is not something that is part of grants. Like we can't pay for the food, but it's definitely a part of community. And I I'm wondering about like how we can influence funders to change the way that they look at um, things that are community building, things that are about trust and storytelling in this example. Does anybody else want to share about kind of making storytelling actionable, at least on the policy side?
I was just thinking that as you were talking, whatever presentation that you may do or have to do, started with a story, started with an actual story of even one about the culture and the eating or whatever it needs to be about, but started with a story because stories tap into the humanity of people. Before you get to all the other numbers and the figures and the stuff, but stories is an exchange of humanity. So started with a story.
Yeah, yes, thank you. Because I think we do start off with the numbers,
Hmm.
uh, and maybe we should not. Maybe we clearly should be starting off with stories. So yeah, thank you for that. There is a question in here in the Q&A that I really want to get to that I've also been thinking about. So, when gathering stories, how do you prepare to hold the emotions that often come with them? Researchers and advocacy workers are not necessarily mental health providers. So, Lindsay, you want to start us off with that?
Yeah, it's a little tricky, and I invite my other panelists to weigh in on this one because I do think podcasting in particular is an opt-in medium. Whether you choose to listen to something, whether you choose to be on a podcast, it's more of an invitation that is accepted, and people, generally understand if I'm going to share my story, I understand what the medium is. And just to give a very clear example, We recently had the mother of a young woman who died by suicide come on the podcast, and her daughter died by suicide because of ChatGPT. And she came on our podcast. And initially, when the idea came up, because, and oh, I should also mention that her daughter was an alum of our school. And when the idea initially came up, this woman had been doing some advocacy work and policy work, talking to some of the big, tech giants about, ChatGPT as a mental health tool. um, we waited for her to come to us. I think someone initially had told her about the podcast, but she was out there writing New York Times op-eds. You can find her work online, and she was more than happy to come onto the podcast and to tell the story of her daughter and what had happened. But in the very beginning, we knew it was a story that we wanted to tell, particularly because her daughter was an alum of our school, and particularly because this is such a big issue in public health and technology right now. But again, we didn't pursue her. We didn't go out and ask for that story. I think there are some stories that just need to come to you. I have also interviewed people. This is obviously a very different shift in energy, but I've interviewed quite a few people that have been laid off in the last year, but from the federal government, which is its own sort of form of sadness and trauma. And again, those people are opting to come into an environment where they want to share their story, where they may be at a place, as Dr. Mama mentioned, where sharing that story might be part of their healing, to tell more people about what's going on and to bring a really human face to those numbers. So again, I believe that what the project that I lead is a little bit more opt-in.
Mhm.
Thank you. Anyone else? The question again was, when gathering stories, how do you prepare to hold the emotions that often come with them?
Oh, sorry. I just want to add one thing. Whenever me or any of our interviewers does do one of these stories, we support each other. You have to create space for yourself as an interviewer too, because you are holding people's stories. And sometimes you end the call and you're like, I need a minute before I transition to my next item of business or my life, So I think certainly making some space for yourself as the person that's responsible for holding this story is important as well.
Yeah,
Mhm.
thank you.
Also think that I am a mental health provider, but you don't have to be, right? Like, a part of the story is emotion. That's why stories are so powerful. And so it's not our job to direct the outcome or how that person responds. We don't have control over that. So we just need to have good intention and hold a safe space and let that person tell that story however they want. And that usually will come with emotion, because a part of the story is emotion, right? When you read a story, you have emotion. When you talk to people, you have emotion. When you retell a story, you're reliving it. And so I think the most important thing is emotions are okay. Hold that space, make sure it's safe, make sure that your intentions are good. And then after the fact, if there's something, if you could provide resources, provide resources. But it's not your responsibility to control that story or control how that person is telling the story.
Of that story. True.
Dr. Mama, anything to add?
Not really. Other than the fact I would say, in our spaces we share emotions too. We experience emotions too. So sometimes we don't know what direction it may go in, but we go in that direction, and it's led often by the persons in the room, because, like I said, we're not trying to be different. We're trying to be a part of. So we let it go, and we go with it. Go with
Yeah.
emotionally too if we have to, because I've cried.
Yes, yes, I find the same in my teaching, that you have to go where the people are going, and there have been tears in the classroom as well.
That's
So,
right.
so yeah, I definitely
But
relate.
that reminds you of your humanity. That reminds you of it. Okay.
Exactly, exactly. That is a part of, and probably the points of, our humanity. So, I want to switch gears a little bit and ask about misinformation, and then I'm going to get to one of my favorite topics of social media. So last year we had a whole series of activities on misinformation. And so I wanted to ask you all about storytelling and narrative change, how it can be used to address misinformation, because that is obviously a big thing in our society right now and at large, but even for particular communities. So, what do you all think about misinformation and how storytelling can be used to combat it, or sometimes it can sometimes fuel it as well? What do you all think about that? Anyone can go, this for anybody.
I spend a lot of time working on this. So I want to just like reverse engineer it really quickly with podcasting. So misinformation and ignorance and intolerance are really rife for being spread by podcasts. I think we know there are certain podcast hosts, they develop parasocial relationships with their listeners. They are developing these strong opinions, and that can kind of perpetuate misinformation. People can certainly believe things and then it gets echoed in online spaces. But there's something powerful about the medium of podcasting that I think can be used, again, to kind of flip that on its head. So just as these hosts develop these strong relationships with their audiences, and then they might be spouting out about like peptides or something much more nefarious, we can do the same with our audiences as well. There are a growing number of podcasts that are coming out of institutions like ours, that are being hosted by communities, that are out there trying to build those relationships and leveraging those relationships to dispel misinformation. And so I think that I see that growing. We don't quite have the power of the platform the way that some of, I think, the bad actors still do, but I do think it is changing.
Thank you. Anyone else? Misinformation, has that come up in your thinking around storytelling?
Not a lot for what we do, but in general, with the misinformation that's all around us, there are spaces like they choose those spaces to listen to those persons. Then we choose other spaces to listen to other people. There are some folks that I listen to and I value what they say wholeheartedly, because I know that they have done the research and they are doing the work and they are in and around the community, and I see them and I know them, and they are out of institution, so I can go with what they say. So I think it all depends on what you're looking for, because people look for that kind of stuff that feeds their opinion. Okay, they're gonna fuel themselves from whoever they need to fuel themselves from, and it's a lot of it out there, and it's all over the place. I feel sorry for them, because the truth will set you free. I don't know what this other stuff gonna do.
Imprison you. Imprison you. Yes, yes.
Yeah.
Thank you. Thank you. Lacey, did you want to go?
Yeah, I think that in our work and in our culture and in our population, misinformation is kind of our everyday life from our ancestors, right? So if you read in our history books, it's not accurately told what happened. Um, and so, and misinformation was, it was intentional, right? It was intentional for the United States to create misinformation to get what they needed. So there's a lot of healing and repair and thinking through how to do that correctly. Um, but also that's a complicated topic also, because then we had a simulation. So how and who that tells a story, experiences are all different, whether you're an urban American Indian, Alaska Native, whether you're from your reservation. And so I think that that is one of the most important uh, like checkers for yourself before you tell any story or you bring anybody to that space to tell the story. Um, Whether or not they're in the community, are they from the community? Are they enrolled and not enrolled? And what piece are they telling? I think is all those pieces that you have to, and why we have misclassification in data, right? Because we don't understand that. And so we're collecting data without understanding that. Um, what we do as a strategy for us to represent all 525, and what happens, I think, in organizations where they're working with marginalized communities, they're working with tribes, they find the token minority and say, I check the box, right? Like, I'm good, I check the box, I'm ethical. And so, especially in Native American communities, it's really important to have representation as much as you can. So we do it regionally. Our membership have area Indian health boards that are regions by the Indian um, health system. And then if we do an advisory board, we make sure that we have at least somebody from each region to do the best that we can to make sure that we're not getting misinformation. But I think that how you do it and making sure you're just not doing it super fast and checking the box is very, very important. And that's one of the biggest things that continues to happen in big organizations, right? Like big that have experience and are trusted are still using the token American Indian Alaska Native to provide them with the information.
Yeah. Yes, you said a lot there, Lacey. I want to ask a somewhat follow-up question, but it's technically a little different, but based on what you just said, because one of the things that I was thinking about is how do communities, populations, peoples think about using storytelling as a tool for health equity when storytelling is a part of the culture, is a part of like cultural identity. And so a lot of when you're talking about what you were talking about, Lacey, I was just like, well, how do we do this in not a safe or respectful way, but like in the righteous way when this is part the actual thing of storytelling is part of the culture, whichever culture we're talking about. Um, Lacey, that was probably not the best worded question, but do you have a response to that idea, I guess?
Tell me if I'm not answering it correctly, if I
Sure.
misunderstood. Um, but right, like we survived genocide because we had oral history, and it was because it was our culture. So we know about um what makes us healthy. We have knowledge keepers. We know how to be a healthy person. We started with stories from utero, right, with animals and those kind of pieces, but also understanding, especially in Native culture, that unlike, well, I guess maybe Western society has it a little bit, but there's protocols and ways and kind of boundaries on who can share that story and how they share that story. And that's how you earn certain rights. You either have to be from the family or somebody give you those stories. And so I think how we do it is we do it very carefully. We do it and we hold space and we try not to control those processes. We do it in a humble, honorable way. Um, and we do it in that we're not the experts, right? And so that might shift our research, might shift our data, but you got to do it in the right way, or that data in that story isn't correct. So sorry, go ahead.
Oh, no, I just wanted to add on and say that, so far, a lot of what we've talked about has been around sort of emotionally heavy or potentially traumatic stories. But I think of storytelling also as a celebration of successes. And, for example, someone from our Center for Indigenous Health actually came to me and said, we'd really like to do a podcast episode celebrating some of the research because so often it's talking about the great health problems and the burdens and just all of the negative aspects. But she said we have this amazing research project where we looked at how really positive childhood experiences had tremendous protective power throughout adolescent and even into adulthood life because of their experiences with their tribes and their communities. And we ended up doing this episode, and it was such a celebration of the culture and of the work. And so I think sometimes, with storytelling, we want to make sure that it's not just used as a way to call attention to a problem, but also to shine a light on the fact that solutions are right there too.
So that got me a little excited, because yes, I think in the way to get funding, right, in our Western system is that you have to show a deficit base. You have to show this negative deficit in order to get money. And so I always think that when we're talking about relationship, we're talking about connection, but there's always a spirit to those stories. So when we're always looking at a deficit-based story and not seeing the beauty of other things like, you know, like the positive childhood experiences, ceremony, and all these great things that we have. The intervention, of course, I mean, I think no wonder our interventions aren't coming out like amazing and healing us. The interventions, because we tell that story in a deficit base, the interventions don't have the spirit of being positive and healing. They come from a pitiful, poor me stance. And so your interventions just don't reach the capacity they could because you start that story in a deficit base. And so in tribal communities, Lindsay, I love that you said that and why it excited me, because we're really trying to shift that in policy, shift that in funders, that we have great things and we've always had these things, right? It just haven't had the opportunity because we have to show you how pitiful we are first.
And I was just thinking, my head was going all kinds of ways, all kinds of spaces and things. But I was hearing stuff like, traditionally, storytellers were the keepers of the history. They taught the lessons. They taught you how to live through the stories. You learn right and wrong from a story as opposed to anything else, and that was done because we all had oral histories at that time, and there are good things in even in the bad situations. There are positive aspects, and you need to dwell in on those, okay? Because like we tell some of the clients in the rooms when we talk about virtues like creativity. Who's more creative than a person on drugs? Okay, you talking about using some creativity. Okay, so you need to just shift that to a better perspective. But you have them, you use them, you know them. So we have many virtues, and even in the worst story, there is something good. There is something good in that story. So you need to find that part and push that part to the top and tell it from that point of view. That's what I would say. Mhm.
Thank you, because first we have a podcast episode coming out where we talk about Black joy and health equity work, and so you all are
Right.
speaking to some of the same things that our podcast guests talked about. Also, we got a flurry of questions in at the last minute, so I have to figure out which one to respond to, and I think this last one is sort of speaking about some of the things that you all are speaking out about. They ask explicitly, how does storytelling shift power? I'm interested to hear examples from the panelists, any examples, and what does shifting power look like? So, do you have any specific examples in which storytelling shifted power, either on the individual, community level, policy level, whatever, however you're thinking about it?
I'm thinking of a story. Okay, not really somebody that I know, but a story about that comes out of traditional Africa, and it kind of goes like when women are with child, they all they take that woman into the forest and they listen for the song of that child, and all the women go with her. And by the time that child is born, they have created a song for that child. So they sing that song at the birth, they sing that song at all celebrations. But more importantly, when that child does something wrong, something that goes against the rules and the expectations of the village or of his mother or of anybody, instead of reprimanding that child, they sing that song and remind that child that that child is loved.
That's beautiful.
Mm.
That's very beautiful. Thinking about, the types of songs that were probably sung over me and I didn't even know it. So yeah, I really appreciate that. And that's
Uh,
definitely shifting power.
yes.
Yes. Um, there is one question here that is sort of like specific and concrete, so I'll ask it. This person says, we are a primarily cis white communications team. Do you have any advice on approaching people for stories and collaborating with them without tokenizing or using their stories? Lindsay, I see you nodding your head. So do you want to respond to that one?
I mean, I've worked in communications for 2 decades now, and this is constantly a source of learning for me. I think there are certainly resources out there for cultural competence that you can pay attention to. I think one of the things that I have tried to do in my career is to lift up the existing resources rather than calling on people to create new ones. So, for example, if you have an amazing organization near you, like Dr. Mama's organization, that's already doing great work, and you happen to have a platform that can feature great work like that's a great way to uplift the voices around you. I think it's definitely you have to have a degree of humility and awareness, and just ensuring that you are very clear about the ask. And I want to just briefly come back to the idea of food, because I think whenever we've tried to ask for things from people, giving something in return, or if you can always pay people if you can, but often we can't. Food is a great way to do that. You can get very flexible in your budget to offer food. I think especially if you're talking about working with maybe students or community members, creating a space that provides them with some resources or some food, and just opening that sort of bi-directional conversation is a way to start to think about these things in an ethical and thoughtful way.
We still have 5 minutes. So I'm going to ask for your final thoughts or closing reflections that you might have for our audience. Any advice, any just things that they should remember for this topic, which is very big of a topic. And I was like, oh, we I have to get through all of this. So hopefully we can have some follow up. But if you have any closing thoughts to share, we'll start with Dr. Mama. You wanna go ahead?
Sure. My closing thought is what I remind people of all the time, is that stories can heal, stories can reveal, stories can teach, and stories can reach. So use them knowing that. Tell them knowing that.
Thank you again, the wisdom. I appreciate you. Thank you so much. Thank you. All right, Lindsay, closing thoughts, reflections, advice, whatever.
I have to follow Dr. Mama's. I
Right,
feel
I don't know what I was
like she
thinking.
summed it up for all of us.
Yeah.
Yeah, I mean, I think just like if you ever get the chance to go back and look at like basic narrative structure of stories, the hero's journey, things like that, when you think about just like the technical side of this work, make sure you pay attention to how stories are constructed. Like we've talked a lot about the ethical and the emotional dimensions of this, but there is also like a technical factor too that I think could be very helpful.
Great, thank you. Lacey, you wanna go ahead?
Yeah, I think really stories are so powerful to really understand the holistic piece of what's happening, especially in health. And so pairing those stories with data, pairing those stories with sovereignty, and then understanding that you're holding somebody's story. So doing that in an honorable, respectful, and I think we keep talking about this, but a reciprocal relationship. And that you're not in control of the story sometimes, and that's okay. And it's a ongoing. I think sometimes we think that we should always know the answer and know how to move. And I think just being and listening is the most important with good intentions.
Yep.
That's great advice. Thank you so much. Thank you all actually for being here. I really appreciate it. I learned a lot. Again, I think this was a very big topic that we tried to tackle in less than an hour, and we did not get to everything. So I really want to say thank you to the panel. We will have more information coming up in our newsletter. So I just wanted to say that we are going to ask the audience actually um, what they thought about this. There should be there we go, a QR code that you can scan, and it's a survey that will tell us, or you can tell us, what was practical and applicable to your work about today's conversation. Just fill it out. There's also should be a link in the chat. Um, with that, we will conclude today's session and invite you to join us for our upcoming interactive learning session in quarter 3. We also have a newsletter coming out, I think on Thursday, that has information, including, like I mentioned, that podcast on Black Joy. For the latest information on the P4HE Collaborative, including all upcoming events and new health equity resources, please visit our website and sign up for the newsletter that I just mentioned, and then connect with us on social media to access shareable health equity content and engage in the topics that are of interest to you. And with that, I want to say thank you so much. Y'all have a great day and take care. Bye bye, everyone.